Assalamu alaikum. My name is Ayman Muin. My seat number is BP1650018, group number 2, and my topic for presentation is urinalysis. Urinalysis is a test of your urine. It is used to detect and manage a wide range of disorders such as urinary tract infections, kidney disease, and diabetes. A standard observation begins with the color and gross general appearance of the urine specimen. The pH and specific gravity are recorded. Formed elements are examined microscopically, and pathologically significant substances, for example, glucose, blood, ketones, bile pigments, etc., are observed. Why is it done? Urinalysis is used to check your overall health as a part of a routine medical exam, pregnancy checkup, pre-surgery preparation, or on hospital admission. It is used to monitor a medical condition, for example, kidney disease or a urinary tract disease. It is also used to diagnose a medical condition based on signs and symptoms of the patient, for example, abdominal pain, back pain, frequent or painful urination, etc. Urinalysis is also used by clinicians to validate self-report of substance use by youth. Urine sample evaluation. The appearance of the urine may reveal clouds of crystals, bilirubin, blood, porphyrins, proteins, food, or drug colorings or melanin. Discolored urine is abnormal. Red coloration may be imparted by blood. Brown color may be because of acid hematine of blood or from melanin pigments. Dark orange urine may be because of excretion of urobilinogen or effects of drugs such as rifampin. Blue to blue-green color may be because of systemic administration of methylene blue. Urine is mostly acidic, so an alkaline urine indicates an aged specimen, systemic alkalosis, etc. A normal morning urine specimen should have a specific gravity of 1.002 to 1.030, so a value of 1.010 indicates hydration, whereas a value greater than 1.020 indicates relative dehydration. Now we come to a case study. RC is a 23-year-old man who was diagnosed with type 1 diabetes mellitus about 10 years ago. Until now, his diabetes has been well controlled with an aggressive insulin regimen. His sister brings him to the emergency department with a 3-day history of fever, chills, dysuria, malaise, and some confusion. He also complains of nausea and vomiting and a poor appetite. Because he has not been able to keep any food down for about 48 hours, he has not taken his insulin. A fingerstick blood glucose is 545 mg per dl, and a stat midstream urinalysis and gram stain indicates the following data. pH is 5.2, appearance is cloudy, specific gravity 1.033, urine protein plus 3, urine glucose plus 4, urine ketones positive, urine bacteria plus 4, urine WBC too numerous to count, squamous epithelial few per HPF, urine nitrite positive, gram stain numerous gram negative rods. What objective data from the urinalysis indicate that RC is critically ill? Subject: age 23-year-old, gender male, chief complaints fever, chills, dysuria, malaise, confusion. Medical history: the patient was diagnosed with type 1 diabetes mellitus about 10 years ago. Until now, his diabetes has been well controlled with an aggressive insulin regimen, but he has not taken his insulin since 48 hours. Object: blood glucose 545 mg per dl. Urinalysis and gram stain: pH 5.2, appearance cloudy, specific gravity 1.033, urine protein plus 3, urine glucose plus 4, urine ketones positive, urine bacteria plus 4, urine WBC too numerous to count, squamous epithelial few per HbF, urine nitrite positive, gram stain numerous gram negative rods. Assessment: the cloudy appearance of RC's urine indicates presence of bacteria, protein, and WBCs, which is also indicated by the data, plus 4 bacteria, plus 3 proteins, and too numerous to count WBCs. The lack of a significant amount of squamous epithelial cells and the presence of a significant amount of nitrite-producing bacteria indicates urinary tract infection, UTI, involving gram-negative organisms. Because the renal threshold of glucose is typically 180 mg per dl. The presence of plus 4 glucose in urine indicates that blood glucose concentrations is significantly exceeding this figure, which is indicated by blood glucose of 545 mg per dl. Acidification of urine and ketonuria occurs after release of ketone bodies into the bloodstream, and that is why it is likely that RC has a severe UTI and diabetes ketoacidosis. Plan. Since we cannot give any medicine to the patient via oral route because of the severe nausea and vomiting, we have to treat him with intravenous antibiotics in the hospital. To treat urinary tract infection, we will give ciprofloxacin 400 mg IV Q12 hourly for 7 to 14 days. The initial priority in treatment of diabetic ketoacidosis is restoration of extracellular fluid volume through intravenous administration of normal saline 0.9% sodium chloride solution with subsequent potassium replacement and low-dose insulin therapy. Standard low-dose insulin therapy consists of initial IV bolus of 0.15 unit of regular insulin per kg, followed by continuous intravenous infusion of regular insulin prepared in normal saline or hypotonic saline solution at a rate of 0.1 unit per kg per hour. That's all. Thank you.